Hello viewers, this is Dr. Sangeeta Datta, consultant psychiatrist, and today we shall discuss dementia. Dementia, as all of us know, it's about impaired mental function. A person who grows old, as he grows old, also becomes slow in his mind, but that is not dementia. In dementia, the primary problem is memory impairment, which is usually short-term memory impairment. In other words, a person who has developed dementia will forget the immediate things like what he did today, what he ate today, etc. But his memory for very old long-term events like what he did in his childhood, where he grew up in his childhood, how many siblings he had, etc., it remains unaffected in the beginning. So a person who comes to us or a person who's brought to us with dementia, the attendants usually tell us that he forgets day-to-day things, but he remembers everything from his childhood or from his youth. So that is how dementia starts. Apart from that, such a person has difficulty taking decisions, making judgments, reasoning properly, etc. As dementia progresses, of course, the memory impairment will increase and gradually the person starts getting confused. And he might stop recognizing his own family members, he might not recognize his own house or his home, and he might go out, wander out of the house looking for his childhood house, or he might just get lost in the process. Such a man, or a woman for that matter, if he or she is untreated and is not attended to, may finally forget himself too. That is the last stage of dementia. In dementia, as dementia progresses, a person may even become incontinent. He may pass stool and urine in his bed. So this is how dementia happens and progresses. The commonest form of dementia is Alzheimer's dementia, which is usually found after 60 years of age. And it can be familial too. It can be inherited. And apart from that, there is another common form of dementia, which is vascular dementia, which results because of a cerebral or brain insult following some chronic non-communicable disease like diabetes or hypertension. That is why it is very necessary to control your diabetes or your high blood pressure so that you don't become demented when you grow old. Sometimes dementia can set in even before 60 years of age, and that is called early onset dementia. Some of the causes of dementia or memory impairment are reversible, like a thyroid problem can be reversed and multivitamin deficiency can be reversed. Apart from that, a severe head injury can also lead to memory impairment and dementia, and that is why boxers often have dementia. Dementia is a problem of old age, and here a person becomes like a child and has to be taken care of. If you suspect dementia in your parent or in a senior citizen, he or she must be brought to a mental health professional. There are excellent medicines for dementia which will decrease the speed of progression of dementia, and sometimes in very early stages, which we call mild cognitive impairment, things can be reversed too. And apart from that, to prevent dementia, of course, we have to remember we have to keep our mind and our brain active, and we have to keep ourselves engaged in work even after we retire from our jobs. It could be shopping, trying to remember what was in the shopping list. It could be solving a jigsaw puzzle. It could be playing with our grandchildren. It could be watching a thriller. It could be reading a novel. It could be anything which keeps your mind or your brain active. Apart from that, for a person who has already developed dementia, of course, medications have to be taken to improve memory, to improve cognition. However, apart from medications, such people need utmost care and love and affection to be able to live a decent life. Sometimes they might need a reminder on their walls about their day-to-day activities and tasks to be done so that they can perform accordingly. Otherwise, these people become very conscious and sometimes they develop low self-esteem, especially when dementia starts. Dementia can happen to you and me. However, if we have proper caregivers, we have proper shoulders to lean on, I'm sure dementia will not be such a huge problem as it is today. So identify dementia early, or even I would say identify mild cognitive impairment early and treat effectively. Do remember to like this video or subscribe this video, and we promise to come back with another interesting topic. Till then, goodbye and take care.